has successfully negotiated the first phase of population control by stabilizing the population growth through massive awareness building and interventions through birth control measures. These measures have largely helped to stabilize the population growth, but clearly this is not enough. We are poised, even at this modest rate of growth, to overtake China as the most populated nation in a few decades from now. What is desirable is perhaps to achieve a zero growth and maintain a healthy demographic balance vis-à-vis a productive and working age group in the long run. It is well understood by now that the further breakthrough can only come through successful neonatal health care and by addressing the mortality rate, which is considered as stubborn in the context of the third world. Today's parents are responsive, being alive to the challenge of responsible parenthood. The urban and the rural divide disappear here as parents wish to see their children grow up healthy into adulthood and aspire for a better future. This, in my view, has been a significant game-changing proposition. The long-term goals of population control could only be achieved through successfully facing the challenge posed by morbid neonatal mortality. Our neonatal mortality rates are still a cause of some concern, with a mortality rate of 44 per thousand live births. Sadly, the maternal mortality rates too are hovering around 212 per 1 lakh live births. This is a huge challenge. I am given to understand that we are envisaging to bring down the infant mortality rate to 25 per thousand and the maternal mortality to 100 per 1 lakh births by end of 12th planned period. This is not an impossible dream to achieve, considering that we are committed to the Millennium Development Goals and to achieve a more acceptable Human Development Index parameter through increased public spend on social sectors, particularly in case of health, sanitation, housing and education. The National Rural Health Mission has been formulated and being implemented by the states with federal support as part of the Vision Plan. I am particularly concerned about the tribal pockets whose access to quality healthcare continues to be an area of concern. The penetration of comprehensive healthcare coverage is slow, but we are addressing these deficits resolutely year after year. Notwithstanding this, the quality of healthcare services continues to be a matter of concern. However, I am not for a diminished role for public health care for the simple reason that if left to the mercy of market forces, citizen welfare will take a backseat. Government continues to be the sole service provider, and rightly so. The solution is also not to bypass the existing government infrastructure either. This will not be socially acceptable. In this context, I am extremely glad with the documentary initiative of NICE Foundation, which is working extremely hard and hand in hand with the government of Andhra Pradesh successfully. It is adding value by addressing the deficits by training local people who are part of the local communities and completely integrated with them by winning their confidence and trust. What is more pleasing is that these initiatives have borne fruit in remote and difficult tribal pockets. This, in my view, is a very good model to build upon further by looking at the nitty-gritty and reformulating our micro-health strategies. These successful and sustainable strategies, perforce, have to be harmonized and aligned with their objectives and goals. Herein lies the biggest challenge. I see this conference as particularly timely and relevant, even as medical professionals, academicians, service organizations, and health administrators are gathered together to deliberate and adopt a viable and sustainable model which will also be cost-effective. Well, Mr. Padmanabh Reddy had made certain remarks, particularly on the tribal healthcare. I quite concede, sir, that our coverage of tribal pockets is yet to improve. But I would like to bring to the notice of this august audience that it certainly is not as bad as Padmanabh Reddy has projected. Things are not really gloomy. Unfortunately, sometimes we tend to take a very gloomy perspective of what is happening in a area. And you must understand, access to these areas is rather tough. Though I quite appreciate that your foundation has made a breakthrough. You have accessed these areas and done a good job by and for these people.